Hey, what did you say? This is Boz and Ben speaking out, and I am on this podcast, episode 90, talking to Dr. Joe Pash. Am I saying that correct, Joe?
Yeah, that's right.
All
You
right,
got it.
Joe Pash. All right, this is a very, very interesting episode. This episode is titled "Hard Time Enhancements and Risks for Men." So basically, what this is that this Dr. Joe Pash is a co-founder of Upsize Clinic. He serves as the medical professional director of its San Francisco branch. He's earned his medical degree from Midwestern University in 2006 and completed his anesthesiology residency at the University of Calgary. Since 2011, Dr. Pash has performed over 1,500 procedures and published work on operating rooms and pain management. He is affiliated with several Northern California hospitals in both Upsize and clinic locations. Wow, you're a busy man, Joe.
Pretty busy.
Pretty busy. My friend, first of all, thank you for joining us on this podcast. I know you're out there on the West Coast, and of course, I'm East Coast. And I'm glad our times are able to align. And I'm honored and privileged to have you on the show. So, Joe, tell us a little about you. I'm sorry, Dr. Joe. Please tell us a little bit about yourself, my friend.
Yeah, so I'm an anesthesiologist by training. I finished residency in 2011 and worked purely as an anesthesiologist for about 10, 12 years. Mm-hmm. And right around 2022, I started to try and look for something else to do. I was interested in men's health. I kind of met various people and thought about doing hair transplants, for example, thought about doing hormone replacement for men. Mm-hmm. And in the process, I actually met a marketing guy who was working with some other doctors, and he told me about this penis enlargement procedure that existed. And I'd never heard of that before. I never thought I would be doing anything with penises. But when I heard that, I kind of went to my wife and I said, hey, would you look into this for me? Like, I wasn't even comfortable looking into it.
Right.
Because, it's like, I'm a guy. I don't want to look at penises and stuff. And
right.
So I had her look into it, and she came back and she said, yeah, it actually looks like a legit procedure. It actually works. And so that was kind of the start. And then I went down this path and learned how to do the procedure, and then started a company that is a franchise business, which is what Upsize is. So in addition to me injecting penises, I train doctors in how to do the procedure, and I help them manage their business.
Oh, wow. Okay. So it's interesting, right? Anesthesiologist to penis in injections, right? I mean, that's a little different flavor there, right?
It sounds like actually more random than it is. The thing is about anesthesia that a lot of people don't realize that aren't in medicine is we do a lot of injections. We anesthesiologists obviously do IVs, for example, but we do nerve blocks, which can be fairly complex. And so they're a little bit similar to injecting filler, and it's in a different part of the body, but basically the skill of injecting anesthetic into or around a nerve translates well to injecting dermal filler or Botox or anything like that.
Okay. I got you. So I looked on your website, and you do mention something about there's like a Botox side, and then I think this one's called a hyaluronic
acid filler and
acid
Botox,
filler, right?
Yeah.
Exactly. So with these two different types of procedures, is it like that they're like similar? Because I mean, one is like actually injecting, the other is like putting some sort of like tiny, thin, flexible tube to fill certain space.
Well, they're both like cosmetic procedures in a way. So that's the similarity, right? So we offer these two separate procedures, but they have different purposes. Dermal filler is the same thing that is basically put in lips. Like you'll see women get it put in their lips or in their face. That's hyaluronic acid. It's a dissolvable, naturally occurring substance that when we inject it into the penis makes the penis thicker. So it's like putting extra layers on top of the penis, right? It's like analogous to making yourself fatter by putting fat in your skin.
Gotcha.
So we put filler in the penis skin, right?
Gotcha.
It
Okay.
makes the penis fatter. So that's kind of the mechanism there. Botox, everyone knows what Botox is. It's a neurotoxin or a neuromodulator. And when that's injected into muscle tissue, it kind of temporarily disables the neuromuscular junction, which is why people that have wrinkles and get it injected into their face muscles, the wrinkle goes away because that muscle stops contracting. So when we put it in the penis, we're putting it in the corpus cavernosum, which is like the functional part of the penis where the blood goes when you get an erection. And so when we put it in there, it makes the blood vessels relax. And by making them relax, it makes blood more easily go into the penis, so to speak. Okay. And so that makes you more easily get an erection. Okay. And it also can make you kind of like your baseline size a little bit bigger because there's more blood flow in it. Okay. So it's kind of like you have like a partial erection more of the time.
Okay, gotcha.
So there's two totally separate things.
Gotcha. So basically, being a man, of course, obviously, men, I was doing some research behind this, and of course, obviously, every man wants to have, nice manhood, right? Strong manhood, right? And once again, real quickly before I go any further in our discussion, I want to let listeners know this is really about the science behind this. This is not meant to be a sexual type podcast. However, there might be subjects around it that may come up, but I want to make sure the listeners understand this is more about science and medical procedures, not about a sexual context of a podcast. So now that that's out the way, I can ask my question. A man wants to be a manly man, right? So you get people to come to your office and they say, "Hey, doc, my confidence is low. I want to last longer in bed." What is it that's like the general consensus of someone coming to your space that really want a procedure done? Is it, obviously there's hundreds of maybe issues or questions or maybe whatever the person wants, but can you narrow it down to a couple that you see on a regular basis that people might come into your office just to get the procedure done?
I think like the most, this might be a little hard for some people to believe, but the most common reason that someone comes is really for no reason at all. They're just like, "Oh yeah, I just was on the internet. I read about this. You can make your dick bigger? That sounds great. Like I thought I'd try that, right?" Yeah. It's like most guys, I guess I'll say that because we're not like we're not taking small penises and making them bigger, right? We're just making normal penises where it's enhancement, right?
Right.
It's like if you have a medical problem, which by the way is very rare, where your penis is like functionally too small, there's not like, we can't do anything in using injections. Like you would need plastic surgery for that, which would be a major surgery. So what we're doing is more like taking what's normal and making it super normal, right? We're giving you like a super
normal. That's the way of putting it. Yeah, we're taking what you got here. We're taking this stand and making it a mic. Yeah, I get it.
Yeah, exactly.
No, I get it. I think, obviously, now with this type of procedure, some men, believe, confidence in having a bigger penis is it's something that's appealing, turning women on and all that kind of stuff. Obviously, that's not the whole reason that you're doing this procedure. Did you say because some guys just walk in your office and they just want a bigger dick? That's it.
Exactly. It's like you don't need there's all kinds of benefits that may or may not bring, right? Like, but most of the time, first of all, if you think that having a bigger dick is gonna make your life like better, it's probably not, right? It's just it's you're doing it just for yourself, but it's not gonna like increase your potential on the dating market or
Right.
make your wife like you more or anything like that, right? It's just something you're just kind of doing for yourself usually.
Gotcha. Well, uh, with something like this done, like what are like, okay, for example, I was doing some research and it says something roughly, and I'm just kind of pulling this on top of my head, about 24-month like period to where then have to come back in again and get it like the re-up on it on the procedure.
Yeah, the filler lasts about 18 to 30 months, kind of. We tell people about 2 years on average.
Mm-hmm.
This particular filler we use is, like you were alluding to before, it's made of hyaluronic acid, which is a naturally occurring substance in your body. So because it's naturally occurring, just like all your other things in your body breaks it down over time and
Mm-hmm.
then rebuilds it. So you have enzymes in your body that are going to break down that filler.
Sure.
But since when you break down your natural hyaluronic acid, your body regenerates it. So, for example, the cellular matrix where all your cells are in is made up of hyaluronic acid.
Mm-hmm.
So you have an enzyme that's constantly like breaking it down, and then your body's recreating it. When we put it in the penis, your body can break it down, but your body doesn't recreate it, right? The way to get
Okay.
it back is we have to inject it again. Now, listeners might be wondering, why do we use something that's temporary that only lasts 2 years?
Right.
And the answer is just that it's safer. Anytime you put something in your body that's permanent, then the risk is that if there's a complication, then you would need surgery to remove it. And so we don't want to put anyone in a position where they would need surgery on an
Right.
otherwise like perfectly well functioning body part. So by using the kind of filler that we need, it's very low risk.
Yeah, I was interested in too in asking that the what are the risks, right, that come with this, right? At a certain age, is there like blood pressure high, or I mean, what are the actual checks that are done to make sure the individual who is getting this procedure done, they can handle what's being done to them versus someone that's walking off the street saying, "Hey, I want a bigger penis."
Well, this is a very low risk procedure, and physiologically, it has like almost no effect on your body. So,
Mm-hmm.
when you come in, for example, for a major surgery, right, we want to know that your heart can handle it and that
Mm-hmm.
your brain can handle it and that you don't have like diabetes and you're going to heal properly and all kinds of
Right.
stuff. In this, it's literally just injections. So there's very few things that would make it like unsafe for someone to have it. So in general, like we want you to be in good health. If you want you to be able to heal properly, for example, but it's not hard on your body or anything like that, where someone that had high blood pressure, that had COPD or like something like that would have trouble getting
Sure.
this procedure.
Sure. Now, obviously, because it's very low risk, which is a good thing, right? For men out there listening, it's very low risk if you're interested in getting the procedure done. However, what about like blotch procedures, right? I mean, people would have come in and maybe they have had, a procedure done, and it's just wind up looking like, some sort of,
A
so
botch
yeah,
procedure.
some, yeah,
Yeah,
some
like,
sort of
can
some
use
sort
your
of crooked
imagination,
sweet
right?
potato, that's
Yeah.
kind of deformed, and you got to come in and say, hey, okay, can you guys like drain what's out of it and then kind of realign it, make it right, make it look like a normal penis?
Well, so if you're talking, so someone that came into our office that had it done somewhere else,
Right.
like if that's what you're referring to, yeah, we get that all the time. Hopefully, if that's the case where they had it somewhere else and it's botched, so to speak, they also got hyaluronic acid filler, which is dissolvable.
Mm-hmm.
Sometimes they didn't. Like sometimes they'll come in and they've had kind of permanent fillers, like made of silicone or something called PMMA.
Yeah.
And so when they come in, there's not a lot that I can do. Like if you have something that's shaped weird, I can kind of fix the shape by putting more filler, but I can't remove what's already there.
I got you.
So those guys, you know, in some cases need surgery to remove it.
Ouch.
Again, though, if they had the type of filler that we use, if they had hyaluronic acid, then it can be dissolved. So the worst case, if we do your procedure, or if like, you know, you have a similar type of filler done somewhere else,
Right.
the worst case is you just dissolve it if it doesn't look good.
Okay.
And that's not common.
Gotcha. So is that like do you guys inject some sort of a solution that will actually dissolve if they have it, you know, the hyaluronic acid will it dissolve? You guys say, okay, you know what, we're dissolving it, we're going to start from scratch, we're going to make sure that all the bad mojo is out, and we're going to, you know, kind of inject our process and get it back.
Exactly
back
correct.
on
And
target.
that's happened like a million times.
Oh,
So the
wow.
process of dissolving it is just literally you just put a injection of the dissolving stuff in, and it just like eats it up immediately. It just turns it into liquid. And I've had patients like I had a patient that not too long ago that he came and got a procedure with me, and it was great. And by the way, this is kind of like analogous to tattoos a little bit in that people will get it done, they'll get a procedure done, and then they're kind of like, well, I should get more, right? So then they come back and they get more, and then they get it bigger and bigger, right? So it's like getting more and more tattoos. Anyway, so I have
Isn't there a cutoff though? It's like a cutoff. Like,
well, yeah,
dude.
eventually you use up your whole body surface area for tattoos also, right?
Right.
But man, as I have a patient of mine, he came in, it was great. And then he went out on a business trip somewhere and was like, he saw, you know, on the internet, some advertisement for someone else doing penis filler. So he thought, oh, well, like how hard could it be? I'll go to that place and get some more put in. So,
wow.
So he went there, and then they botched it. So then he came back to my office, and he was kind of like, sorry, doctor, I cheated on you. I was in San Diego or wherever on a trip.
Yeah.
And I got filler put in, and now it's all botched. So then I had to dissolve all the filler like that I gave him and that the other person gave him. And then he came back again, and then we did it again.
Okay,
So
I got you. So he was one of the lucky ones, right? So he was able.
Yeah, he was lucky. He at least got the dissolvable filler.
You know, with everything going on, Doc, I have to ask this question, right? You have so many, like, you know, you had the Botox. I was talking to a young lady. She was like, yeah, I got to get some in my forehead to get the wrinkles out. And then, of course, you've got other, I think it's another company called Sonobello where they're actually draining, you know, the fat off of folks. And then, of course, you know, you got this different types of, you know, gastro bypasses and everything is just like this world. I mean, what's really natural for us, right? I mean, I get it. This is part of your, you know, your process and what you do, and I'm not knocking it at all. I mean, I think it's actually you have at least a safety in mind, right, when you do this, right? So when people come to your office and they want to get this procedure done, and I'm sure you go to some sort of consultation and you might ask them these certain questions. What determines if you turn somebody away, right? What is it that what's that hidden factor that you say, you know, well, I don't think that this is right for you based on X, Y,
it's
Z.
rare, but I've done it. It's like the main red flag is someone's having issues in their life and they think that this is going to solve it, right? Because this cosmetic procedures are not the solution for your life's problems, right? So I've had an occasional person that's like, you know, my marriage is failing and whatever, and if only I had a bigger penis, like
that's insane.
That's insane. It's like, you know, you're clearly your whatever's wrong with your marriage or going on in your head has nothing to do with your penis. And so, like, in good faith, I can't do a penis procedure and take a bunch of money from you right now and fix that, because what you think is going to happen is not like a reasonable, it's not a reasonable expectation.
Yeah. Insane. As I hear you speak on this, and once again, real quickly, this is episode 90 called "Hard Time Enhancements and Risk for Men" with Dr. Joe Pash, and I'm just Doc. I'm just it's insane that people think that this procedure will save a marriage or will get them more women, or maybe they're watching too much adult content out there on the internet and they're like, wow, I want a penis just like that. I want to have a bunch of women. I'm going to do a bunch of things. And it's just insane to me that society has, shall I say, culturally conditioned us to do things based on what they see out there in the public versus what they think is good for them internally. Right now, if I'm coming to you and say, hey, doc, I'm a little self-conscious. I want to get, you to do this procedure. It's safe. It's proven. You guys got a good 99.999% record of not doing anything crazy. I'm going to go with you. Let's get her done. Right. And now you finish. Like I'm assuming you can see your results instantly, right?
Yeah.
Maybe. And then, of course, now I'm back here in Indianapolis, and I go see another doctor, and I'm like, hey, man, I'm getting a lot of good feedback. I want to get it done again, right? And
yeah.
And then I'm going to get it done again, and you look up, and you're looking like it just looks, it don't even look attractive. No woman wants to insert that thing into them. Right.
It can get out of control for sure. Like, and so it's not, the most common thing is someone comes once and I do it and then that's it. Right. But I've done a lot of procedures by now. So I do have a handful of people that have gotten out of control, and it's like they just want it bigger and bigger and bigger. And then at a certain point, though, I think it becomes obvious to them that it doesn't look like natural anymore, right? And but some people are okay with that, and it's like, how when you see like, you don't see it so much anymore, but you would see like triple D like breast implants or whatever.
Yeah.
And it's like, I mean, they voluntarily got those put in, right? Like,
yeah.
And no one told them it was going to look natural, and they voluntarily got them put in. So
yeah,
so, I see that a little bit sometimes, but most people come and they just get it
right.
They get it done,
and that's the thing too, Doc. I'm like, I knew a young lady who had some breast implants done, right, and I think she got them done like, I don't know, early 90s or whatever. I mean, she's about 70 years old today, so I mean, it was a long time ago, 30 years ago, give or take. And so she got them done, but then of course her husband, he was telling me that she was having problems with one of them was started to fall, so to speak. I know the silicone. I don't know, but whatever it was, okay. One was perked up, the other one was kind of sagging, and it looked like a lazy eye, So, so he was like, he wanted to send her back to the doctor to for them to pick it up and put something in it and cut it again. And I was like, dude, just. Is that even safe, right? If I know you want her to look good, you want her to put a nice dress and have her nice big breasts, I get that. But, at this point in time, she's like, late 50, 60 years old. And do you really want her to go back and get it tucked up or pushed up? Is there a certain cutoff? Is there a certain age you to say, you know what? I mean, I'd ask that question because what are some like the ages that you see? Have you seen guys come in maybe in their 50s and 30s and 40s? That's normal. Maybe in the 20s, I get that. But let's talk about 60s or 70s. Are people still getting that done at that age?
Yeah, like I've had a guy that I think my oldest patient is in his mid 80s.
Wow.
Probably a lot of listeners that are younger don't know this, because I didn't know this until I was in med school. But
right,
old people have sex, right? Like, it's hard to believe, but 85-year-olds have lots of sex. In fact,
hope so.
One of the jokes is like, but it's not really a joke, is that like nursing homes are like the biggest party there is, right? Because everyone's sleeping with everyone in the nursing home.
Let's go from room to room. Yeah.
Yeah. So I guess like just because you're 85, it doesn't mean you don't also want a bigger dick. Like, but it's hard. I think it's hard for like a 20 or 30-year-old that's not in medicine to like wrap their head around that. But after you're around like a lot of old people, you just kind of realize they're having just as much fun as us, like,
well,
40
hey,
and 50-year-olds.
at the end of the day, I mean, they are human, right? So life is life. Life goes on, right? So what should a man ask, right? Let's do this. Let's role play for a second. I walk in your office, say, Doc, I want to get this procedure done. I just want to, get a filler. My size is okay, but I want it to be bigger, So I guess what's the first question you would ask me as a new client?
Well, I always ask if you, I want to make sure you understand what the procedure is that we do and what it can do and what it can't do. So I guess I want to know, like if you're my patient, I want to say, what are you what are you looking for?
Right.
What can I do for you? Right. So you come in, you say, hey, I'm here to get a bigger dick. And I say, okay, like, let's, why don't you tell me exactly what you're looking for? What are you expecting here? And then you tell me, I want to add 6 or 7 inches in length and 9 inches in girth. And then I say, well, that's not reasonable, right?
Yeah, it's like a big.
Or or you say, yeah, I just want to get like a reasonable amount, and then it's like, okay, now we're having like a real conversation.
Okay, all right, you're talking off the ledge, right? Because some folks may come there with like, exaggerations, like you just said, right? I want an arm length, and I want a Coca-Cola can worth. I'm just like, whoa, okay, is that really attractive?
You have to be like, let's do the geometry here and the physiology, and explain how making a thing from this big to that big is not like a reasonable,
practical,
right?
So do you find it for like deal with men who are not like circumcised, right? Do you find it a challenge to deal with? Circumcision is, of course, some men are, some men aren't. Is there any difference in, with that extra layer of skin on top of the actual head of the penis? Do you find it a bit challenging to actually, inject those versus having a circumcised individual?
Yeah, it can be more challenging to do this type of procedure if you're uncircumcised.
Mm-hmm.
It's totally doable. It just takes a little bit more skill and more time. And sometimes we have people come back for we stage it over 2 visits instead of 1. In fact, with permanent filler, there's a lot of doctors that won't do it at all if you're uncircumcised, just because the odds of needing some sort of correction are like pretty high. But with the type of filler we use, we can do it. It just takes a little bit more skill.
Okay, I got you. I was going to ask about the risk behind that, right? So
again, there's very low risk, because if we do it and you're not happy with the outcome, we just dissolve it. So.
Wow, just like that, huh?
Yeah, it's very easy. And again, it's uncommon, but it's like that. It just, if we're talking purely about risk, then there's not really risk if you can reverse something that you did, right?
Right. So what about regulations, right? Like with anything you do, right? You've got, HIPAA, somebody got regulations, you got things in place that you have to follow to make sure that you're doing this correctly. And what type of I'm not saying if it's something to do with the FDA, but what type of like audit type practices are in this space, right? When people come in and say to audit your records, they want to make sure you're following certain procedures and certain processes. I mean, what is it that you have to follow in order to make sure that you're doing this in a regulated environment?
Sure. So, and that's a good question for potential listeners that are looking at getting this done. If they decide to go somewhere that's not me or one of my businesses,
right?
It's good information. So in the United States, that you have the FDA that you alluded to, or that you mentioned. The FDA regulates medical devices and drugs. Okay, so the filler that we're using is a drug. Okay, so
Mhm.
I mean, it's people don't think of it as one, but it's regulated as a pharmaceutical. So the
Mhm.
first thing is that in order to legally, and it's a prescription pharmaceutical. So in order for it to like legally be administered or bought or sold or whatever in the United States, it has to be FDA approved.
Mhm.
So we're using FDA approved medications. Now, the asterisk on that is that FDA approves things for certain uses. So for filler, it's FDA approved for use in the face, not in the penis.
Mhm.
As long as the FDA has approved something for some use and you're a doctor, you can use it for what's called off-label use. So, for example, someone gets a prescription for antidepressant. The FDA approval is, say, to use it for a month, but they're on it for 5 years. So that's like an off-label use. But the key is that it's been approved for something and it's being prescribed by a doctor. So that's essentially the first thing. Make sure if you're getting filler injected that has FDA approval, it's being sold legally. Then in the United States, you're going to want it to be either a doctor that's injecting it, or in certain states, it could be a nurse practitioner or a physician assistant.
Mhm.
If they're in some states, they would need to be supervised by someone. In certain states, they could do it alone. In my case, I'm a doctor, and all the other Upsize doctors are doctors. So
Mhm. Mhm.
you have doctor doing the procedure. It's an FDA approved product. You're pretty much like, those are your regulations, right?
Mhm.
You have to have a medical license. Your office has to be clean and hygienic, and you have to have a business
Sure.
license and pay rent and all that kind of stuff. But those are kind of your main, if you're looking for like regulations. It's just that it's an approved drug and that you're legally uh, licensed to do a procedure in the state that you're in.
Okay.
So that's
Gotcha.
a technical answer to your question.
No, no, no. I mean, obviously, I mean, you follow a set of rules and regulations, right? And
Yeah,
of course, like I mentioned earlier, for where my employer, we had to follow, by the book, right, just to
yeah,
make sure. So I totally get that, and just wanted to make sure I asked that question. So I want to pivot a little bit, and this is dealing with, I believe the it's called micro penises, right? I mean, obviously, it says 6 out of every 1,000 men have a micro penis, right? So when you come across situations as such, right? And this is more of a question about the research behind it. How do you really, I mean, I know it builds confidence, and you probably follow the same exact procedure you do with someone with a regular, normal size penis. However, is there a particular, like, I don't know, do you use a special filler just to kind of, like, make sure, or is it all the same, no matter micro?
well, we don't. So really, we don't really do the procedure on micro penises,
Uh-huh.
and I think we kind of like touched on this earlier. It's just that in that case, it's more like a surgical issue. Like we can't, like a micro penis is the origin or the etiology of that is that they didn't get enough hormones during, like, male hormones during development.
Mhm.
So it's too small for it to be like, um how do I say this? It's too small and there's not enough room for us to put the filler in.
Sure.
Um, so someone with that would need actual like reconstructive surgery, and so it's not something that we would be able to make a meaningful enough difference on to be able to do it. Um, Having said that, I've never had anyone come into the office with a micro penis. I think it's fairly rare, like you said, 5 out of 1,000 or something like that.
Mhm.
Uh, a lot of people think they have a micro penis, but they don't. So, it's very common the guy comes in and they say they have like a micro penis, and then you do an exam and you see it and it's like totally a normal size.
Gotcha.
You just have like a kind of a skewed idea of what normal is, right? Maybe from watching like movies or whatever.
Yeah, exactly. Right. As I said earlier, a lot of guys, they see something on television or not television, see something on a movie or an adult
stuff that's
channel.
not on television.
Yeah, not on television. Right. Exactly. And they might say like, oh, wow, I want that. But, you know, the camera, the camera can shoot at different angles to make things look, you know, it's like that thing in your car, objects in the mirror appear to be closer than they really are. Right. Yes. The camera can do that. However, you know, I do want to ask a question, and the question I want to ask is, as far as your anesthesiology background, right? So, what does anesthesiology and pain management play in modern medicine, right? And enhancement procedures, how do they tie into each other in this space?
So, how does anesthesia and pain medicine tie into
management
this?
And pain management? You're right.
Do you mean how does it tie into this procedure that I do?
That's correct. Right.
Yeah. Well, like I was saying at the beginning of the show, anesthesia, like part of the skill that we have as anesthesiologists is doing lots of injections. So we're really familiar with needles and image guidance. So we do injections using ultrasound, for example, and really understanding or having a good grasp on different tissue planes. For example, if you listeners or yourself might know someone that's had an epidural done during childbirth.
You
know, you're putting a needle through a bunch of layers of skin into the spine, and that's probably like 2 inches deep, and you don't know where the only way you know where the needle is just by kind of visualizing what's going on underneath the skin and in between the skin and the spine. And so that's a skill that we have with just being able to like guide a needle around. And so that kind of that skill that then we can use in this kind of procedure, because we're putting a needle in the penis, and it's good to have an idea of where you think that needle is, right? And so I guess what I'm trying to say is someone that has experience using needles is going to find it a lot easier to do an injectable procedure such as a penis injection than someone like you might be a brain surgeon and you're like the best surgeon in the world and the smartest guy in the world, but you might not have experience putting needles in things.
Sure.
That's like a skill in itself.
Sure. No, that makes perfect sense, because that kind of leads to my next question. Like going back to that scenario again, I come into your office. What are some of the red flags I need to look for, or some of the questions I need to ask as a customer or a new client when I come into your office? Say, okay, understand your background, understand, you know, how many folks have you done? What's your success rate, right? I mean, what are some of the questions I need to ask, or what you recommend for someone to come in right off the street to ask the actual practice?
Yeah, good question. And you basically answered your own question. How many have you done? That's like an important one. And the other one is to see real before after pictures, not canned ones or ones that you stole from someone else's website, for example. Like when people come and see me, I have like an iPhone filled with literally like 500 or 600 before after pictures, so I can sit down and just like scroll through, you know, like, and it's pretty obvious that I've done a lot of procedures and the real pictures. So if you go in someone's office, you should definitely, I mean, they might not have 500 before after pictures, but you should get an idea of how many they've done and you know, if they have good results.
Wow.
So you're going to find a lot of doctors out there that have never done one, but it's advertised on their website, for example.
Okay.
So that's something that's not illegal, right? Like, so that's the problem.
Well, I went to your website, and I really like, by the way, listeners, upsizematters.com. That's the website Dr. Joe has. And I went to your website, and I was just kind of looking at your before and after results, and I really like how you have like the protection, the filter on it, right? The kind of, you know, hey, 18 or older, understand what you're looking at basically, and you have the gallery, and you really have a sort of like a protection, really, on it. It doesn't like slap you in the face. You really got to be looking for it in order to actually see it. And I really can respect that because, there are some sites I went to and I'm doing some research and it is out there. Right? They're just out there. I'm just like, God damn. what about the kids looking at this kind of stuff? Man, you gotta have some sort of protection, some sort of filter out here to make sure that it's being monitored of some sort, right? So I really can respect that. So at the end of the day, Doc, the question I have is that how can listeners, learn more about safe and effective male enhancements from someone like yourself?
Well, they should go to our website. If any of the listeners go to the website, there's the easiest thing is there's an option to send a text message, and if they do that between 9 and 5 Pacific time, Monday to Saturday, they'll get a response from one of our 3 real people that are in the United States that answer questions about this stuff. So it's not like an overseas call center. It's like a real guy in California or Nevada that's been working for me for years that can actually like have a discussion with you about any questions that you might have. So I think the easiest way is to send a text. You can also call, or you can also fill out a web form, and the result will be the same. You can get someone on the phone, and they'll explain everything you need to know. And as you said, before-after pictures are on the website, and also there's quite a few articles and stuff like that, just with general knowledge. Anyone wants to go to the blog section.
Gotcha. Well, I definitely appreciate your website. I appreciate your time, Doc. I think that it's always something new, right? You just never know. I learned a lot looking at your website. I learned a lot actually understanding, about the fillers. And I was thinking about like how some folks, like you said, the Botox and things of that nature, right? Where everyone's doing it. And this is a very, low risk medical procedure. And I really can appreciate the care, right, that you guys offer as well, not just with consultation and the actual procedure itself, but actually caring about your clients as well, right? And understanding, hey, we can't do this, we can, you don't need this, you do, right? And really that says a lot about your practice as a whole. So, at the end of the day, my friend, congratulations and good luck with your business.
Thank you. Thanks for having me. It was good talking to you.
Yes.
And hope everyone learned some stuff. And if you have any questions, just go to the website and send us an email.
Absolutely.
Send us a message.
Once again, that's upsizematters.com. And I have Dr. Joe Pash. I got to say your name right.
It's all good.
I think about Joe Pesci when I sounds like Joe, right? Joe.
Right. Yeah, that's a good point. Yeah, it's very similar, isn't it? I don't look like him though.
No, you don't. No. However, I do appreciate you. Thank you very much, my friend. Much success in your practice, in your business, and we're looking forward to learning more and maybe even bringing you back, because basically I have a question about like the really before and after, right? The after, right? We talked about how some guys just get like tattoos and it gets going, going. But what about those guys you can't really help? Right? You got to say, you know what? You got to slice and dice. We got to do a medical procedure. And it's just like, can you really fix it? Or are they really screwed? Literally.
Well, I mean, do you mean screwed like it doesn't look good, or screwed
like it doesn't look good? It's totally tongue twisted stuff, right?
Yeah, I mean, I've had patients from other practices that we can't help, if that's what you mean. But
yeah, that's what I mean.
Yeah, totally. Like, it's unfortunate, but we could have a whole other show where we talk about botched procedures. Like,
that's the part.
I have another hour of discussion on that.
That's the part 2. Exactly. That right there, my friend. That's the part 2 I'm talking about. the botched procedures, right? And just kind of giving your shall I say, your feedback on what you've seen and all that fun stuff. But once again, Dr. Pash, thank you very much. Appreciate you being on Men Speaking Out. Looking forward to reconnecting with you on a part 2. And
Nice.
my friend.
Me too. Likewise.
Yeah. Have a wonderful evening. Appreciate you.
Okay, you too.
All right. Take care.